Colon cancer, also known as colorectal cancer, is a prevalent yet often preventable disease that affects millions of people worldwide. Despite its high incidence, it's often dubbed a silent killer due to its tendency to develop without causing noticeable symptoms in its early stages. However, by being vigilant and attuned to subtle warning signs, we can catch it early and improve treatment outcomes. In this video, we'll delve into 10 silent red flags of colon cancer that you mustn't overlook. Let's embark on a journey to empower ourselves with knowledge and safeguard our health naturally. Persistent change in bowel habits. One of the earliest signs of colon cancer is a persistent change in bowel habits. This may manifest as diarrhea, constipation, or a change in stool consistency. While occasional bowel changes are common and often benign, persistent alterations in bowel habits lasting more than a few weeks should prompt further investigation. Keep track of any changes in frequency, texture, or size of stools, as these could signal an underlying issue in the colon. Rectal bleeding or blood in stool. Rectal bleeding or the presence of blood in the stool is a significant red flag for colon cancer. While bleeding from the rectum may occur due to benign conditions such as hemorrhoids or anal fissures, it can also indicate the presence of polyps or tumors in the colon. Even small amounts of blood should not be dismissed, as they could be indicative of an underlying issue that warrants further evaluation. Unexplained weight loss. Unexplained weight loss, particularly when not attributed to changes in diet or physical activity, can be a concerning sign of underlying health issues, including colon cancer. Cancer-related weight loss may occur due to factors such as decreased appetite, metabolic changes, or the body's response to the tumor's growth. If you notice a significant and unexplained drop in weight, it's crucial to consult your healthcare provider for a thorough evaluation. Fatigue and weakness. Persistent fatigue and weakness that interfere with daily activities should not be overlooked, as they can be indicative of various health conditions, including colon cancer. As the cancer progresses, it may lead to anemia due to chronic bleeding or disrupt the body's normal physiological functions, resulting in feelings of tiredness and exhaustion. If you experience unexplained and prolonged fatigue, it's essential to seek medical attention for further assessment. Abdominal discomfort or pain. While abdominal discomfort is a common complaint with numerous potential causes, persistent or recurring abdominal pain should not be ignored. Colon cancer can cause cramping, bloating, or pain in the abdomen, particularly if a tumor obstructs the colon's passage or causes inflammation. Pay attention to the location, severity, and duration of abdominal pain, and consult your healthcare provider for evaluation if symptoms persist or worsen over time. Feeling of incomplete evacuation. A persistent sensation of incomplete evacuation after bowel movements may indicate an obstruction or narrowing of the colon, often caused by a tumor. This sensation may persist even after multiple visits to the bathroom, leaving you with the feeling that your bowel movements are incomplete. If you regularly experience this sensation or have difficulty passing stools, it's essential to discuss it with your doctor to rule out any underlying issues. Changes in bowel caliber. Changes in the size or shape of stools, particularly if they become pencil-thin or narrow, could be indicative of colon cancer. These changes in bowel caliber may occur if a tumor obstructs or narrows the colon's passage, leading to changes in stool shape and consistency. Pay attention to any persistent abnormalities in the size, shape, or appearance of stools, and discuss them with your healthcare provider for further evaluation. Iron deficiency anemia. Iron deficiency anemia occurs when the body lacks sufficient iron to produce an adequate number of red blood cells. Colon cancer can contribute to anemia through chronic bleeding from tumors or polyps in the colon, leading to a decrease in red blood cell count and subsequent anemia. Symptoms of iron deficiency anemia may include fatigue, weakness, shortness of breath, and pale skin. If you experience these symptoms, it's essential to undergo evaluation to determine the underlying cause and receive appropriate treatment. Unexplained abdominal mass. The presence of an unexplained abdominal mass or lump may indicate an advanced stage of colon cancer. As the tumor grows, it can create a palpable mass in the abdomen, which may be detected during a physical examination. If you notice any unusual lumps or bumps in your abdominal area, seek medical attention promptly for further evaluation and management. Family history of colon cancer. A family history of colon cancer or polyps significantly increases your risk of developing the disease. If you have close relatives who have been diagnosed with colon cancer, especially at a young age, you may be at higher risk yourself. It's essential to be proactive about screening and surveillance, as early detection can greatly improve treatment outcomes and prognosis. Colon cancer is a serious health concern that requires prompt attention and early detection for successful treatment. By recognizing the silent red flags of colon cancer and seeking medical evaluation when necessary, you can take proactive steps to safeguard your health and well-being. Remember, prevention and early detection are key, so don't overlook any potential warning signs. Stay informed, stay proactive, and prioritize your natural health forever. Thank you for watching. Don't forget to like, share, and subscribe for more in-depth content on health and wellness. Your pursuit of well-being starts here. See you in the next exploration.